Yes, that's probably.
I mean, he's so frustrated and so hard to listen to every night.
The little piece of the real world.
Yeah.
Right.
Right.
You guys can get out of here at some decent time after a long day.
Yeah, and
For life?
we good?
You handle Spurger or Berger?
I'll do the roll call for you.
Okay, well, that's okay.
It's Perger.
Did she have good?
Okay? Yeah.
There we go. All right. Call to order the Summit County Public Health Board of Health Human Resources Committee meeting August 13th, 2026 at 6:14 p.m.
All right, I'll do a board member roll call. Ms. Colner.
Here.
Blakesley.
Here.
Myself. Here. Mr. Lowry.
Sure.
McGuire.
Yes.
Dr. Mamonis.
May I have a motion for unanimous consent and a second to conduct business by voice vote unless a roll call vote is specifically required by our bylaws, state law, or is requested by a member of the board?
So moved.
Second.
Dr. Blakesley.
Yes.
Myself, yes. Ms. Colner.
Yes.
Mr. Lowry.
Yes.
Mr. McGuire.
Yes.
Dr. Mamonis.
May I have a motion and second for approval to approve the HR committee meeting minutes from March 12th, 2026, which are, I believe, included in your packet.
It was there, right? I'll make the motion.
Second.
It's Miss Betty.
All those in favor?
Okay, I didn't know if we had to ask for discussion on minutes.
Oh,
All those in favor?
Aye.
Opposed? I will abstain because I was not present at that meeting. So moving on to the election of a committee chairperson, and will there also be an election of a vice chair at this point as well?
yep. So we have to elect, because this is a new year, we have to elect a committee chairperson. I usually ask, does anybody want to do it? Does anybody have a desire to be the committee chairperson?
I'm happy to step up.
Okay, okay. Can I have a motion and a second to elect Ms. Colner as chairperson of the Human Resources Committee?
Moved. Second.
Okay. All those in favor?
Aye.
Any opposed? Any abstentions?
I abstain.
All right.
Thank you.
Keep going with the.
I'm happy to keep going. Thank you for that vote of confidence. Can I put that in and under the same?
Yep.
Okay. At this time, I'd like a motion and second. Well, first, I guess we need, if there's a volunteer for somebody that would care to serve as vice chair of the Human Resources Subcommittee for the coming year.
Okay.
Don't everybody speak at once.
Yes, I will do it. I will be your vice chair.
Okay.
About this committee, so.
So we need a motion and a second to elect Dr. Mamonis as vice chair of the Human Resources Committee.
So moved. Second.
And may I have a vote? All those in favor?
Aye.
All those opposed? And any abstentions?
Dr. Mamonis abstains.
Oh, I abstain, sorry.
And I didn't vote because I was asking for a vote. Thank you, Dr. Mamonis. All right, the next item up for discussion is the Health Commissioner Goals Update. In the enclosure are the goals that Commissioner Barker has proposed in alignment with the strategic plan. Would you like to
I can give it an overview.
express that?
So goal one really looks at ensuring accurate documentation, effective communication, and legal compliance in all board activities to support informed decision-making and transparent governance. So this is really continuing, I believe, what a previous goal was, especially with this topic. Goal two is to drive operational excellence and growth through the implementation of the 2027 to 2029 strategic plan and incorporation of quality improvement initiatives to support reaccreditation and progress and program and service improvements. So this is the implementation of our strategic plan process. Since this is the first strategic plan that was developed under my tenure as health commissioner, I think the overview and the implementation of the strategic plan should be an element that I'm evaluated by. Goal three is to identify, mentor, and prepare internal talent by expanding professional development programs, delivering continuous core skills training, and providing managerial mentorship to support succession planning, drive workforce excellence, and to strengthen agency retention. So this is really looking at building our workforce. This is one of the components that is identified within our strategic plan, but really stands out as an area that I personally would like to see addressed this calendar year. So it's something that we're working towards, and I thought would be a good goal to highlight and be evaluated under. Any questions?
So as we did the commissioner's evaluation last time, all of the assessment was tied to the goals. So as we talked about this and planning the goals for the coming year, with the intention of creating the same kind of evaluation that is very goal-oriented, but tied back to the strategic plan, because everything the Board of, or the Health, Summit County Public Health does should tie to that. So hopefully all of this alignment will serve the department well, as Commissioner Barker. So do we have to take any action on this aspect?
On the goals?
Yeah, is there anything we do, or is it just like?
Falls within the committee.
Yeah.
That's sharing.
We'll just share it at the board then.
So the next item on the agenda is the organizational planning discussion.
Angela, that could be discussed in this component. So within your packet is an organizational update and position requests. I want to take this opportunity to really just cover some of the potential changes that could be taking place and ultimately leading to a request for certain positions that we do not have appointed, and also a reclassification of some positions. So first off, in administration and support services, with the retirement of Tawanda Weems, which is our current registrar, we are looking at, I believe it's a reclassification of the position to a vital statistics supervisor to serve as the registrar, and a vital statistics business coordinator to serve as the deputy registrar. This really represents a change within the structure. Tawanda's title was business coordinator, thank you. So this is a change to move that position into a supervisory level and a coordinator level position.
You're basically taking her job and making it into two different jobs.
We currently have a registrar and a deputy registrar position.
Oh, okay.
They're lower in our classification,
Okay.
schedule. The current registrar's job entails supervising that entire program. That, is one of our only, live external facing programs where they, business management type thing. So I feel that, it's unfair to have that position not be compensated the same level as any other supervisors in the agency. So I feel like it would align that position with other supervisors who have the same level of responsibility and offer additional, opportunities for staff that are currently here.
So that's a position Ms. Weems had, now is a bump up.
Yes.
It's kind of, I'm just going to say this because I see it happen sometimes. That's kind of a bummer for somebody that has filled that position for that long, that they were not recognized at that level. And then once they depart, then suddenly that position is looked at and compensated differently.
I don't disagree. historically, the positions in the supervisor level have had qualifications, degrees, and
Understood.
that are not, that are current staff.
So just by virtue of experience and dedication to her role, she was able to do that,
Yes.
without that. Yeah, for 33 years, you said?
33 years.
I understand, yeah. And then to fill that role then requires the education.
She retired?
Yes, yep, she'll be leaving at the end of this month.
Big gap.
Mm-hmm.
So we're asking to reclassify that, and then the deputy registrar, we would like to move it up in the same accordance, a few steps higher, so that that person can then be, her backup, and when she's not in the office or whatnot, would still have authority. And we are required to have a registrar position. The deputy position is not a requirement, but we've always had it filled.
Any questions? The next position pertains to the fiscal office. We have refrained from filling the assistant director position. We have appointed a fiscal officer, that is Edith Dillard. I don't think Edith was here.
Mm-hmm.
No, Edith. Oh, she was? Okay,
Mhm.
Edith was here. Yes, she was in the back corner. We're looking at a position for a fiscal supervisor to also be appointed. This position would primarily be scoped towards the management of grants. Because we manage a pretty significant number of federal and state grants, greater emphasis on our grant management processes would be the responsibility of the supervisor position. We want to improve communication back and forth between fiscal office and our programs. And in case additional requirements are coming in line with the federal guidance that's being changed, this will also align to support that. But the primary intention of this is to support not only continuity for the fiscal position, so we do have some continuity in place, but also to really focus on the collaboration coordination between our programs and our fiscal office specific to grants to make sure that that is good communication pathway between our programs and our fiscal department. Do you have anything else to add, Angela?
This is also returning to the former program structure that we had prior to the assistant director being put in there. So prior to that, it was fiscal officer and supervisor. We'd just like to return back to that.
Any questions?
Okay. The next one is pertains to the Office of the Health Commissioner Support Service presently, but this is the creation of a division of strategy and systems. This is primarily just an organizational shift with no changes in programming, staffing, or finances. Programs that are currently underneath Corey Kendrick, which includes behavioral health, information technology, epidemiology, informatics, and the community impact program. That's currently by the organizational chart under the Office of the Health Commissioner. This would just be the creation of a division formally within our organizational structures. But again, there's no changes in programming, staffing, or financial aspects of this. The only changes that would have to happen are just minimal requirements, and that's really just some of the back-end work on Munis and MyCHD, which is our internal system to support payroll and fiscal reporting. Any questions? Okay. The Community Impact Program, this is just an update. We recently appointed a Community Impact Supervisor on the July board. David McCartney was appointed that position. The position oversees the development of community-oriented assessment reports, notably the CHIP and the CHA, but also oversees the Social Service Advisory Board, the Summit County Community Health Improvement Coalition, and also the Trauma Informed Care Initiative. He is supported through mixed funding through general revenue grants and also through contracts for service. We do have an active job posting for a program coordinator that would report to Mr. McCartney. The intent of this position is to support the Community Impact Supervisor on the above initiatives, and this position would also be supported by grants and contracts. And again, that is presently posted. Behavioral health, there is a position request for one coordinator, but I think that's going to be postponed right now. So I think that was just on the provided document. I'm going to withhold on that conversation. Epidemiology program, we did have a resignation that occurred during the August board for a coordinator. We are requesting another coordinator to basically backfill that position. We had a meeting to define the scope of the epidemiological program. Right now, that is a program of 2. It was 3. But we wanted to reassess moving forward to not only address continuity for epi coordinators that are assigned and our chief epidemiologist, but also to look at the division of responsibilities to make sure there's proper cross-training. So the scope of this epidemiologist will vary slightly from our traditional process. So there is a change happening there, and we intend to be posting that soon as a backfill.
The resignation, do we know what happened to them? Did they go to a different system?
I believe just resigned. I'm not sure of.
Not sure.
The next is division changes in family health. Upon the resignation of Christy Cato, we looked at some revision within the family health program. We shifted most of the programs around to fit the 2 manager positions and the supervisor position we had to make sure that we load balanced accordingly on the grant initiatives, as 95% of that division is grant-based services. One of the big changes that we did is we put a posting for a WIC manager position. This is something we haven't done in the past, but because of the size and scope of our WIC operations, having a manager specifically assigned to do that was advantageous just for programming purposes. And Nikki Maffey, who was a supervisor on WIC, was appointed to that position. There is a position request to backfill that WIC supervisor position, and also for 1 dietitian and 1 public health aide. These positions would be supported and are supported entirely through WIC funding. There will be no impact on general revenue.
So is the supervisor over the manager, or the manager's over the
The
supervisor?
managers over the supervisors.
Okay.
So we would have a manager and a 2 supervisor structure. Because we operate multiple satellite sites at the same time, this would help with coverage at each location. The updates regarding the Division of Environmental Health, there's some significant changes that are occurring within this division. We intend presently to refrain from filling the Assistant Environmental Health Director position. That was Ali Rogowski's position. And our intent is primarily to focus on mid-management. We want to look at the mid-management workforce and to really build their capacity to support their growth and development. Ultimately, the cost savings from the previous assistant director would be allocated to fill the other positions that I will mention here following. Within the air quality program, Sam Rubens, manager of air quality, is planning to retire here at the end of this year. During July board, we appointed Julie Brown as manager to basically serve as his replacement, and the appointment was intended to support cross-training for Julie, as Sam is here. Julie Brown was previously a supervisor, but her position would be on hold at this point in time. There is 1 opening for air quality position, but I think we recently filled that last week, I believe. There's a retirement that's going to be taking place as well for an engineer in December, at least that we expect. Once that retirement occurs, we intend to keep that open, primarily due to the workload. We don't need to fill that at present, but we'd like to retain that capability just in case demand does increase. One of the most notable changes will occur in water quality. This position request may occur towards the end of the year, if not into next year, and that would be another water quality supervisor and 2 water quality coordinators. So this would make a mid-management structure of a manager, 2 supervisors, and 4 coordinators, with 2 coordinators reporting to a supervisor. This follows a similar process. Go
I
ahead.
just wanted to say all these changes are outlined on these org charts
Yeah.
that you have if you want a visual, and they're all in white, like anything that's white is white.
All right, thanks, Angela. No, perfect.
I just wanted
You gotta follow if you follow it like this.
Perfect. This structure follows a similar model that was in place for the past. Usually in our water quality program, it is divided by operations and maintenance. So we would basically structure the water quality program at division. And this would, again, support continuity of positions, but also cross-training and help build the capabilities of that program specific to the functional areas. We presently have 2 coordinators in that program. but we're looking again at having two, and a division between two coordinators to a supervisor. Within the food safety program, the manager that's presently in the position is expected to retire in July. We do intend to backfill that position, but we have a request for another food safety supervisor. So that would be a very similar structure where we have a manager, two supervisors, and 4 coordinators in total. I believe there's 2 presently in that structure now. So this will be, again, 2 coordinators reporting up to each supervisor. The responsibility of the food supervisor would be targeted to not only support span of control, because that's one of our largest programs. It's a lot for our manager and supervisor to manage that significant size. 20-some staff, I believe, is in that program, maybe just under that. But the intent is also to support retention and also to enhance food safety educational initiatives. That's one of the topics that has been not a priority lately. We started to do some initiatives, but we want to bring that back. And that's one of the strategic areas that we want to address in the food safety program, is to increase the frequency of trainings that we provide to operators regarding food safety and food preparation. Healthy Homes Manager, this one would likely be posted in 2027 or 2028, so we do not intend to fill this presently. This is a Healthy Homes Manager position. Right now, this is on hold. We have a 2-supervisor structure presently within that program. The previous manager, I believe, resigned several years ago, and we just haven't backfilled. So this one's on hold, but we wanted to retain that if needed in case that program does grow. Vector operations will likely increase, specifically around tick-borne responses. And then also the housing and nuisance program could also be expanding as well. So this gives us that capability to expand as the programming around that. And then the last one for environmental health is the EH administration support. This would be a request that would likely be filled either towards the end of 26 or early 27, and that would be 1 office manager. This position would primarily be oriented toward software implementation and management of the EH Health Space Cloud system. That's the system that we use to manage basically all of our environmental health. And also, to conclude, 4 internship positions. This is just an area that we want to expand on. How many internships do we have? 4 or 6, I believe?
We have 4 currently.
Okay.
Plus 11 of the temporary staff that we can use for the mosquito in the summer.
All right, thank you. We frequently get a lot of requests for internship opportunities here, and that's something we want to definitely offer, that we can find a fit into the organization. So that's just something we want to expand the capability for.
Are those paid positions?
Yeah, these would be paid that we would be asking for. We're not looking to fill them immediately. We just want to have more opportunities, more open positions and people on.
Well, I think that's great if you can get, you know, especially like the college students that are graduating and stuff, get them in. And
It's not uncommon
And
to come back with grant funded too.
But where's the funding for these positions, like water quality, for example? I mean, you're adding there, for example.
Most of the environmental health is offset by the assistant director's position that will go unfilled. This will probably cover about 3 years until it will be an additional expense for the agency to backfill.
you know, the other thing for the internships is at the college level, some of them are required to do internships.
Mhm.
I don't know if there's a way to tap into universities
The resources.
that offer public health to just say, hey, we've opened up these.
So Eric's team has already started, we have affiliations with different universities in the area where we work with them on just that type of thing, required internships for coursework completion. And we do bring people in unpaid to do those types of things. So the difference is paid versus unpaid. Is the benefit ours? Are we looking to bring in people to do work that we need done, such as some of our grant work? We have interns that come in and we pay them to do that, versus is the need for them to get their education requirement met. So
I believe the most significant expense will be around the fiscal supervisor position.
Mhm.
We have, so that will be an expense, so it's going to be partially offset by the, we filled fiscal officer instead of assistant director to do that work. So there is going to be some offset for the next year and a half, cost to the agency. But then we have two, fiscal staff who will be retiring in the next 2 to 3 years. So, bringing someone in at the starting level of those two positions will definitely be a savings for us in the future.
What about employee count? How many employees are we adding?
So we have 170 currently bodies. That's not FTEs, but that's because we have like 9 part-times that are currently in our mosquito program that are the students that work 21 hours a week or so. They're actually all on the board agenda, the consent agenda this month. They're leaving to go back to school. And then we have I think 2 more part-time employees in the agency. So we have about, 162, 63 employees after that. And then in this paper here, on the back of that is an attachment of our current open positions. So this is a list of the open positions we currently have
I have
available.
some questions on that.
Sure.
I'm really blown away by that.
Sure. And then what we're asking for is, the 4 interns, the fiscal supervisor, and the water quality supervisor to add. So we're asking to add 6 positions. But yeah, if you have questions on that, I can definitely.
On that particular list?
Yes, I
Yeah.
can hopefully answer them. If not, I can get you the answer.
I mean, it's kind of tough to comprehend. I mean, we've got, like, these are open positions?
Yes, these are the specific job title and how many openings we have in that job title.
And then you've got,
So I think,
10 administrative assistant positions open and 10 public nurse positions open.
Yeah.
And all year
Yes,
so far.
Those aren't
Not
posted
actively
positions.
posted.
Those
Not
are just
actively recruited.
existing that you have chosen not to post and fill.
yeah,
I'm
so,
sorry, what is
so
it?
these are positions that have in prior years been filled, that either through attrition or reorganization, they're still on the books as open positions, but we're not intending to fill them.
Okay.
Right, so none of these are intended to be filled.
Right.
so I think this is really helpful, because it helps me.
Goes through all of them.
It goes through so if you want to take a look at, you know,
I went through that too. I just looking at it, I mean.
Yeah.
I didn't understand this, if we're looking to hire another 111 people.
No,
but, yeah.
So this is basically for your
Yeah.
knowledge,
Not
that
that
you
big.
know, what we're asking for, like the supervisors we're asking for. We have 3 currently, but if you look at these, there's more than 3 supervisors that we want to fill. So we need 2 more to meet, to do what we want to do. Yeah.
This was helpful to me because I didn't know where everybody was
Oh, that's
initially.
great.
So then that way I'm like, okay, because they would say somebody is moving to such and such, and moving over to
Yeah.
such and such, and
Mhm.
I couldn't comprehend it, so this helped. That's why I like this
Yeah.
diagram, because it helped me realize who was moving and shifting and
Mhm.
what
Where they were going.
What's amazing, obviously you're keeping all these people busy doing things, so it's an awful lot of work going on here.
Anybody have, yeah, anybody have any other questions? Staff position?
You good to go? Okay, may I have a motion and a second to approve the following positions and position changes? Fiscal supervisor new, public health intern 4 new, vital statistics deputy registrar reclassification, vital statistics registrar reclassification, and water quality supervisor new. So move.
Second.
Any discussion? All those in favor? Aye. Those opposed? Abstentions? All right, thank you. Do we need the executive session?
We do.
Okay. May I have a motion to adjourn to executive session at 6:42 PM to consider the appointment, employment, dismissal, discipline, promotion, demotion, or compensation of a public employee or official, or the investigation of charges, complaints against a public employee pursuant pursuant to Ohio Revised Code 121.22G1.
Second?
Dr. Blakesley?
Yes.
Myself, yes. Ms. Collier?
Yes.
Mr. Lowry?
Yes.
Mr. McGuire?
Yes.
Dr. Mamona?
Okay.
We reconvene at 6:59 PM with no actions taken. Next item is there any miscellaneous business? Notice that the next HR subcommittee meeting is scheduled for September 10th, 2026, immediately following the Board of Health meeting.
There's a possibility that we will cancel that meeting, for right now, just scheduled.
All right.
Okay.
Do we have to have a motion to end the meeting, or are we just done?
No, you can just.
Okay. Thank you. Meeting adjourned.
Thank you.
I have to brush up on my parliamentary procedure.